wanted to talk to him about was medical personnel. And I went over with him again the reality in New York City, the fact that we have until next Sunday, April 5th, to get the reinforcements we need, particularly when it comes to ventilators. In fact, I asked the federal administration to get us additional ventilators even earlier. My request to them is to get 400 more ventilators in by April 1st, because we've seen such movement with this disease. We have to be ready for all eventualities. So my hope is that we'll see some of the results we've seen previously in the last few days. And again, there's a lot we could talk about what the federal government has and hasn't done over the last 2 months. But in the last week, we have seen some real support, and I want to see it again with the 400 ventilators we'd like to get in immediately. Then we have a lot more we're going to need by Sunday, April 5th and beyond. And certainly the medical personnel, which I talked to the President about repeatedly, and to the Defense Secretary and the Chairman of the Joint Chiefs of Staff. I think the best way for us to get a lot of that medical personnel is from the military. Everyone's been receptive. I'm waiting for specific results. But again, I will keep hoping that these very specific requests and very specific conversations will yield what New Yorkers need so that we can be safe. The fact is we remain the epicenter of this crisis nationally. A day will come when I will be able to no longer use that word, and we all look forward to that word. But right now we are the epicenter, and the numbers are staggering. And again, they all represent real people, real families. As of this morning, we were at 32,308 total cases, a stunning number, and we have lost, and this is so painful, 678 of our fellow New Yorkers. That means in the last 24 hours, from this morning to Saturday morning, we lost 161 more people in this city. People of all walks of life, every kind of New Yorker, and it's so painful for everyone that we're going through this, and we have to fight back with everything we've got. I want to tell you some of the stories because it's important to understand the lives of the people we've lost, and so many of them were devoted to all of us and helping all of us and protecting and serving their fellow New Yorkers. And I have to say, every loss, every death is painful. I feel a particular sense of loss when it's one of our public servants. So I want to name some of them and talk about them very briefly. At health and hospitals, and Dr. Katz is here, I know he feels the same pain as we discuss the loss of some of his colleagues. We lost at health and hospitals Frida Okran. She was a psych educator at Jacobi, previously the head nurse of the psych unit, and a mom supporting her family, but also supporting her mom who lives in Africa. So what a horrible loss for that family, that hospital, and our city. Another story of tremendous commitment, Teresa Lococo, a pediatric nurse at Kings County Hospital serving families and children. Amazingly, she was in her 48th year of employment in our hospital system, protecting her fellow New Yorkers. 48 years serving us, and she gave her life helping others. We've heard terrible losses from the MTA. Our colleagues at the MTA, we grieve with you, and we're so sorry for what you're experiencing. Of course, we all heard the story of Garrett Goebel, 36 years old only. He'd only been working at the MTA for 6 years. Out there helping to keep the city run in this crisis. A fire on the train put his life in danger, and what did he do? He worked to get everyone else to safety first, and then got off the train and passed away immediately after. Leaves behind 2 young sons in his family. So sad, and someone who, again, was right there at the moment, his last moments of his life, protecting others, serving others, saving others. Also from New York City Transit, Peter Petrassi, 21 years as a conductor, and a beautiful tribute to him was posted by his nephew Dylan, calling him the most loving, enthusiastic man, always putting others before himself. You see this really painful pattern here of people who just cared so much about others, and we're losing such good people. Also, Oliver Cyrus, a bus operator, 21 years at the MTA, based at the Manhattanville Bus Depot, a quiet and humble man, loved by his coworkers. We have lost Oliver as well. And then you heard painful loss at the NYPD, a man who worked at One Police Plaza I mentioned yesterday, or Friday I should say. We've now lost Detective Cedric Dixon, 23-year veteran of the NYPD. He worked in the 3-2 precinct in Harlem. Not only a great detective, but someone that everyone who knew him knew would always be there to help other people. Electronics and tech genius who always could fix things for other people. A horrible loss for the NYPD and the city. And from the NYPD as well, Jacomina Barr Brown, an administration assistant in the Bronx 49 Precinct roll call office, 7 years in NYPD, and the kind of person her colleague said she lit up the room with her smile, also always there for other people. And the FDNY, we rely on the FDNY in so many ways. They've lost James Veloco, auto mechanic. He's been with Fleet Services since 2014. And this is the kind of unsung hero who doesn't get the credit he deserves. This is the kind of man who keeps us safe because he kept the ambulances in good repair so they could get there to help all of us. We grieve with his family in Staten Island. Finally, NYC and Company, they do such important work promoting New York City to the world and helping bring in all those tourists, all that investment that helps this city to keep moving forward. NYC and Company has lost Hubert Raleigh Nurse. He was there for 30 years working to promote New York and share New York with the world, and now we've lost him, and all of us, all New York grieves with his family. These are examples, and it's just so painful to say that's just a small, small fraction of those we've lost. As I said, these are the people we've lost who are our colleagues in public service, and as you heard, every one of them an amazing story of sacrifice and concern and love for their fellow New Yorker. So we see this crisis growing, and for weeks and weeks we've been talking about getting ready for this, and we have to get ready for even more. And it's not just the incredible toll this is taking on our healthcare system. As you've heard in recent days, the number of cases is growing, is also putting a huge burden on our emergency system. I can't thank enough everyone at EMS. They're doing amazing work under the toughest circumstances. Our EMTs, our paramedics, all the officers, everyone who is doing such important work at EMS. We thank you and we feel for you because I know that the number of calls to 911 have been skyrocketing. It's putting a huge, huge demand on EMS. Let's be clear, and Commissioner Nigro will be available to speak to this later on in the question and answer. This is unprecedented. We've never seen our EMS system get this many calls ever. But what Commissioner Nigro is doing with his team and our Deputy Mayor for Operations, Laura Anglin, is we're making a series of very fast, intense moves to ensure that more personnel will be available for EMS. We're going to shift personnel onto the work of EMS. We're going to come up with more ambulance shifts, additional vehicles, whatever it takes to keep serving New Yorkers who are in emergencies. We're also going to make sure that folks who don't have a pressing emergency, because we all know for years and years folks have called 911, and most of those are true emergencies and some of them are not. Anyone who's calling and needs something else, doesn't need an ambulance but needs a different kind of help, we're going to find a way to get that to them too, so ambulances are never going to a place that they don't need to be. But what we have to do first and foremost is put on more personnel, more ambulances, more shifts, and we are doing that immediately so we can serve the true emergencies, and there's a lot of them, to make sure that New Yorkers get the help they need. Obviously, there's been a lot of attention on the situation in our hospitals in general, and in particular at Elmhurst Hospital in Queens. I'm just going to give you a few quick points. Dr. Mitch Katz here with me will talk about Elmhurst and health and hospitals more specifically. But look, the bottom line is the incredibly valiant team at Elmhurst has gone through so much in the last few weeks. It's an extraordinarily effective hospital, real professionals who have found a way to keep saving so many lives while dealing with such pain at the same time and real loss. And you can imagine how hard it is for people whose whole life is saving lives to see that sometimes there is no way to save a life. But they have been doing amazing, amazing work to save so many others. We've been sending constant reinforcements, so 169 clinicians have been sent in recent days to Elmhurst. That means physicians, registered nurses, nurse practitioners, and physician assistants. 100 nurses this weekend alone. In addition, within the hospital, clinicians have been moved from outpatient activities to ICU activities. Staff from the central office of health and hospitals are moving in, taking on roles in terms of ICU and emergency department. We're going to keep moving personnel and getting more personnel constantly to help Elmhurst and every other hospital that needs it. This is going to be an extraordinarily tough next few weeks, but we will keep sending more and more reinforcements. And again, we have to get the good people who are there doing such tough work. We have to get them a break. We have to spell them. And this is why I want to see medical personnel come in, not just from New York City, but from all over the country, including those military medical personnel, because we have to give these extraordinary heroes a break at places like Elmhurst. Also, ventilators. We have added 55 ventilators to Elmhurst over the past 2 weeks, and we will keep adding whatever number of ventilators they need. So this will be a nonstop effort. Across health and hospitals, the whole system, the 11 hospitals, 500 contract nurses have been added already, 500 more coming this week. So we are just going to constantly reinforce. Now I want to turn to supplies and the distribution of supplies, and I've already said our first milestone is this coming Sunday, April 5th. We must shore up to get ahead of the challenges we will start to face that following week. So this is a race against time. We have gotten some real help, as I said. The ventilators that came in from the federal government, some are coming in from other sources. That's helpful, incredibly helpful. We need it all, and we are thankful for it all. Yesterday, we sent 1,400 ventilators out to our hospitals, to all types of hospitals. That is a huge step forward, but that number we need overall is still 15,000. So we've made a big dent between different sources. To get toward that 15,000, we have a long, long way to go. We still need to see the federal government do a lot more and more quickly. We need the Defense Production Act utilized to the maximum. We need to see a distribution system that's fast and intense. And again, I think the military must be involved. And again, my specific request to the federal government is 400 more ventilators by April 1st to get us ready for later in the week when we expect the upturn to really intensify, and we need those ventilators to be in place and ready. In terms of personal protective equipment, PPEs, a very moving moment yesterday when the United Nations provided 250,000, 250,000 surgical masks to the people in New York City, to our healthcare workers, our first responders. The United Nations, we are their home, and they did something very good for their hometown with 250,000 surgical masks, and we've asked them any and all help they can provide going forward. We will need it, and those masks are getting out to our hospitals right away. Dr. Katz will speak to the overall situation, but my message to all the doctors, the nurses, the hospital staff, starting with all our colleagues at health and hospitals, our public hospitals, but to all those out there in the voluntary hospitals, the big hospital systems, the independent hospitals, we are all in this together. We're going to go and work to get you every conceivable supply you need and get it to you quick. We have to protect our healthcare workers, and that's what we're working on every single day. And we can only, all of us who are not healthcare workers, can only imagine what you all are going through. We have to be there for you and get you all the help, including the additional personnel, immediately. That's our job. In terms of health capacity, we're all really moved by the fact that the USNS Comfort is arriving tomorrow. I'm really looking forward to greeting the men and women, the medical professionals, the sailors, everyone who's making this possible. I want to thank our colleagues in government at the Economic Development Corporation who played a crucial role for the Comfort to dock and be able to add immense hospital capacity for the city instantly upon docking. Well, they had to be able to dock, and they weren't going to be able to dock unless The dock was dredged to allow for a ship of this size. The operation was supposed to take 2 weeks. The folks at EDC, working with the Army Corps of Engineers and the State Department of Environmental Conservation, they got the job done in 8 days. And so the Comfort will be arriving tomorrow and will right away be making a difference in this city. And we are so, so grateful to the Navy, to the military, that this new help will be arriving in our city. Also very important in Central Park, and we're going to be using every place we need to use to help people. Mount Sinai Hospital, working with the relief organization named Samaritan's Purse, is creating a 68-bed field hospital. So this is the kind of thing you will see now as this crisis develops and deepens. A partnership with Central Park Conservancy, our Parks Department, the Mayor's Office, we all work together to get this done with Mount Sinai and Samaritan's Purse. Going up now in the East Meadow, should be operational by Tuesday. Some other quick updates for you, and then I'll turn to Dr. Katz, and then we'll go to questions. There have been concern about those incarcerated. Update in terms of our jail system. As of last night, over 650 inmates have been released. Again, working carefully with the state of New York and the DAs, and being very, very mindful of public safety while also being mindful of deep humanitarian concern. Over 650 released. I can update you and say that since this crisis began, our jail population is down by about 860, not just because of the releases, but because we've seen falling crime and lower arrests. Want to thank the DAs and the state for their collaboration and cooperation, working all together. And the state, I think, made an important decision related to those on parole and working through the right approach there. And I just want to commend the state for that. There's been concern about our juvenile detainees. A number of actions have been taken. Over the last 2 weeks, there's been a significant reduction in our juvenile detainee population. There's been a 67% reduction in one category, 53% reduction in another category. So when you combine that, obviously, we've been able to reduce very, very substantially. It was not a huge population to begin with. We'll get to the exact numbers. But more than half of those who have been detained over the last 2 weeks have been released, again, while always making sure there is follow-up and monitoring to protect safety. I want to thank our Deputy Mayor for Health and Human Services. I want to thank the Law Department, Mayor's Office of Criminal Justice, and the Administration for Children's Services for working together to ensure that was done properly and quickly. Related to transportation, a couple of things. Staten Island Ferry, we had made a substantial reduction in service because ridership was down so intensely. We have seen ridership continue to drop. It is now down 86% from the same time period last year. As a result of lower ridership and the need to conserve resources and a number of factors, we're going to be moving to hourly service on the Staten Island Ferry. That will be 24/7, but it will be hourly service. There's so few people using the ferry now compared to what we normally have that we had to make this move. It'll go into effect at midnight tonight. And then related to our subways, we've gotten some reports of crowded subway cars, despite obviously a huge reduction in subway usage. Obviously, there's been service reductions as well. We've had some times where there was a service problem, and that led to, in other words, service had been delayed, and that led to some crowding. We are going to work together, the MTA and the NYPD, to go and do spot checks and immediately intervene if we see any subway cars that are crowded. I want to ask all New Yorkers, again, this should not be something you see very often. And if you're on the subway, it means, of course, to begin with, you're an essential worker or you're doing something essential under the rules. There obviously should be a whole lot of New Yorkers who have no reason to take the subway at this point. But if you do have actually essential reason to be on the subway and you see a crowded car, we want it reported immediately to 311 so the NYPD and the MTA can act on it. And if you're an individual in the subway and you see a crowded car, please avoid that car. Please go to a different part of the train or wait till another train comes. It's crucial that we avoid any crowded cars. What social distancing means everywhere, including in our subways. I'll finish up and then a couple words in Spanish. On a very, very important topic, which is the direct relief that New York City needs from the federal government. I had several calls today and over the last few days with Senator Schumer, who is not only our senator, of course, but is the Democratic leader in the U.S. Senate. I spoke as well this morning with Treasury Secretary Mnuchin. The two important topics. The first is regarding the third stimulus just passed, ensuring that the resources devoted to New York City could be accessed immediately. That's $1.4 billion so we can keep providing essential services to New Yorkers. I'm very satisfied, based on the conversations with Senator Schumer and Secretary Mnuchin, that we will have access to that money very quickly and under rules that will be very usable and flexible. So that's good news, but I immediately spoke to both about the need for the fourth stimulus, for action to be taken in the month of April by the Congress to provide real and immediate relief to New York City and New York State, given the vast new expenses that we are incurring to help people, to save people, to protect people. We must get additional support. We all know all parts of government are losing a huge amount of the revenue we depend on to provide services to people. The Congress, the President have to act to keep New York City and New York State whole. It's the right thing to do morally. It's the right thing to do to protect people. And anyone who wants to see a recovery, you're not going to have a recovery if the nation's largest city and one of our largest states cannot do our work and are not going to be solvent. We need that support. So I spoke to them about that, and I feel, in addition to the conversation last week with Speaker Pelosi, I feel hopeful that additional help will be coming. Finally, just to say, we're having a strange experience. All of us would go out in so many parts of the city and see something we've never seen before, or only once in a while during a blizzard or some very exceptional event. We see a lot of empty streets, a lot of empty sidewalks. I'm sure it feels strange. It feels strange to me. I'm sure it feels strange to so many of you. Remember that that's a sign that New Yorkers are taking the instructions seriously, that they are doing the right thing. The vast, vast majority of New Yorkers are doing the right thing. The vast, vast majority of New Yorkers are practicing social distancing, are really only going out when they absolutely need to, and are staying in otherwise. And I really want to thank New Yorkers, all of you, for the way you're handling an incredibly tough crisis. Again, we will get through this together. It will not be easy, but we will get through this together. Quickly in Spanish. Cada vez más estamos perdiendo neoyorquinos que están al frente de esta crisis. La ciudad está trabajando día y noche para apoyarlos con todo lo que necesitan. Todos los podemos ayudar. Hay que quedarse en casa para no propagar el virus. With that, I want to turn to the head of our health and hospital system. The men and women under his command have been doing extraordinary work, and he has been doing extraordinary work keeping the largest public health system in America running in the midst of the biggest public health crisis we've had probably in a century in this country. I want to thank him for his leadership and his spirit and for the great work of the people that he every day commands. Dr. Mitch Katz, CEO of Health and Hospitals.
Thank you, Mr. Mayor, for recognizing the amazing heroes that are working every day at health and hospitals, as well as the private nonprofit hospitals throughout New York City. It is extremely difficult work. People know that the vast majority of people who are COVID positive, who get the virus, do just fine. 80% of people don't need hospital care. Of the 20% who need care, only 5% of the total need ICU care. But imagine it the other way. You're a doctor or a nurse at the hospital, and what you see is patient after patient coming in critically ill, and your actions are determining whether that person has all of the medical care they need. And our staff are performing so well under very difficult conditions. Our emergency rooms are about twice as filled as usual. Our intensive care units are about 3 times as large as usual, and still our staff are often using new equipment, working with new colleagues that we have never, who have never been in that hospital before. People are learning together. People are rising to the challenge. It's extremely difficult work, but they are doing it. I want to be clear that everyone who has needed a ventilator has gotten a ventilator, that people who need the protective equipment have gotten the protective equipment, but there is tremendous anxiety about the coming weeks, and that's why we're so grateful to you, Mr. Mayor, for advocating for our healthcare workers to make sure that they have the equipment that they need, both the equipment in the sense of ventilators to save lives, as well as the equipment to protect them. We know that there's a lot of fear that that equipment is going to run out, and we're so grateful to you for your advocacy efforts. Thank you.
Thank you, Dr. Katz. Okay, we are going to go to questions, and please let me hear the name and the outlet. Go ahead.
Hi, all. Just a quick note at the top. We'll ask everyone to limit themselves to just one question in an effort to get to as many outlets as possible. Also, just a reminder that we have Dr. Barbeau, Police Commissioner Shea, Fire Department Commissioner Negro on the phone today. With that, I will start with Todd from AM New York.
Okay, Mr. Mayor, Dr. Barbeau, I'm interested in finding out, with the growing loss of life from coronavirus, can you speak to what is being done to accommodate the influx of bodies and people we've lost, the relationship with the funeral homes, and whether or not there's any risk to people handling the bodies or even the loved ones of passing on COVID-19 after people have died?
Todd, it's a painful topic to say the least. Dr. Barbeau can talk about the safety measures in place and the concerns, if any precautions need to be taken. I want to say that, look, I'm going to keep, whenever this topic comes up, I'm going to keep it very broad and very brief. We have the ability to deal with this very, very tragic part of this reality. We have gotten a lot of support from the federal government to make sure we had what we need to deal with it. All I can tell you, I'm not going to go into detail, and my colleagues can get you more detail after this press conference, but we have what we need to deal with an absolutely tragic situation. Our job is now to focus on what we need to do to save lives. Dr. Barbeau, do you want to speak about how precautions are being taken?
Yes, sir, Mr. Mayor, and I want to just echo what you've said in terms of all of our efforts thus far really being geared at reducing the spread of this virus and giving the healthcare system an opportunity to absorb the number of individuals that are unfortunately stricken with COVID-19. With regards to COVID-19 and people who have deceased because of it, there is no indication at this point in time, based on experience from other countries, based on the science that has been published, that there's any risk to individuals from this respiratory virus. I want to remind you that it's a virus that's spread by droplets, and after someone is deceased, there is no risk. We at the Health Department are very focused on working with funeral homes and ensuring that as one of our essential services, our burial desk is working 24 hours a day to help meet the needs of families that have unfortunately lost someone to COVID-19.
Okay, go ahead.
Next, we have Shant from the Daily News.
Yeah, thank you, Mayor. I was wondering if you could elaborate a little bit on what you want to see from a fourth stimulus. Do you have a dollar figure in mind, and what kind of things that funding would go toward?
Yes, Sean. And this is a conversation. Look, and I'm always grateful when our federal officials are responsive. Secretary Mnuchin was very responsive. Obviously, on the legislative side, I've spoken to Speaker Pelosi and Senator Schumer. They've been extraordinarily responsive. There's no question in my mind at this point that a fourth stimulus bill is coming and coming relatively soon. I spoke to Senator Gillibrand about this as well. Everyone's saying the same thing, and that's a very encouraging sign. Our delegation, I spoke to the entire congressional delegation a few days ago. Obviously, Congressman Jeffries is very high-ranking in the House leadership as well. Everyone is agreeing that another stimulus bill is coming soon. We have to ensure that that stimulus bill reflects what's happening now, not just in New York, but increasingly, tragically, all over the country. And you have noticed coronavirus doesn't discriminate. It is now in all 50 states, red states, blue states, big and small. The next stimulus needs to replace the lost revenue that cities and states have lost as a result of coronavirus. There is no other viable path to making up the kind of revenue we've lost, billions upon billions of dollars, very quickly, more to come, unfortunately, while we're trying to keep essential services going. And I want to remind everyone, anything that's about saving lives right now, money's no object. We're going to do everything and anything to shore up and strengthen our hospitals, to support our first responders. Whatever it takes to save lives, that costs a lot of money, and it is the right way to use money. But if you combine all the huge new expenditures with all the loss of revenue, and we have to provide the basics every single day, we still have to fight crime and make sure the garbage is picked up and everything else that the city does. I think it should be literally replacing the lost revenue and funding the additional expenses that were incurred because of COVID-19. And that should be for all states, all cities. But this time, instead of a bill that treats everyone like there's no differences in the reality, this bill must reflect where the actual epicenter has been and ensure that New York City and New York State are truly whole, not just a token amount, but are truly whole.
Next, we have Aaron from Politico.
Hi, Mr. Mayor. You said on Friday that you were concerned